There are opiates, and that is definitely an option for treatment of pain.
Who would you select to try opiates on? Of course, you have to be careful because it is an opiate. What would you try it on, and how would you select that?
Well, I think you have to take a lot into consideration when you're thinking about using opioids. Not, I think it's more accepted to be used in an acute situation, so for a short term. But anybody who you might choose to use opioids long term, there's a lot of controversy involved in that.
In the 60s, if you wrote for an opiate, you were considered a bad doctor. In the 90s, if you didn't use it, you were considered a bad doctor. Now people today think we should be selective, a little bit in between the two thinking states. Is that correct? You have to be careful how you use it?
The pendulum has definitely swung back the other way, but there's a lot of research out there that indicates that maybe these aren't the best medications, or you have to be very, very careful about using these medications in people for long-term use when it's what's called non-malignant pain that's not related to cancer.
Because what happens, at least I hope I'm right about this, you get tolerant to it. The dose that you were using doesn't work. You need a little bit higher dose and a little higher dose. Is that one of the problems you would have with opiates?
Well, there's several reasons why people have a lot of concern about using these medications for long-term use, as well as for use in young people. The first is that you could get tolerant and that you end up needing more medication. The second is that it actually changes the way your nerves sense pain, and they actually may make you feel more pain. And then another reason is that it can affect your endocrine function. So there's a lot of research out there identifying that people have decreased estrogen, testosterone, cortisol levels, which are some of the more important hormones that regulate your body.
And some could easily get addicted to something which started as pain, but after a while you could have a problem down the road.
Well, addiction is a whole other issue that is always a concern when using these medications.
So you do use it, but you're much more selective than, let's say, 10 years ago. Is that true?
Yeah, again, I think there are a lot of practitioners, a lot of people that really don't think that this is a good option for both young people or people that are going to need to be on the medication for more than, say, 3 to 6 months.